Hey, welcome back. It's good to have you here. I was on a flight back from Dhaka a few months ago, and I had this moment of profound disconnection. I was scrolling through my phone, and there it was, a notification from an airline app one barely uses. It said, "Hope you enjoyed your trip to Bangladesh. Your digital health pass is ready for your next journey." And I just froze. I hadn't uploaded any test results. I hadn't linked any accounts. The app just knew. It knew where I'd been. It assumed a health status, and it was already prepping for my next movement. It felt less like a convenience and more like a quiet announcement. Your body, your location, your life, it's all just data now. And someone, somewhere, is always listening. I'm Ibnul Jaif Farabi, and this is The Unraveling Thread, a production of Light, Not Studios. Today, we're pulling on one of the most sensitive and urgent threads of our time, the rise of the biosurveillance state, and how the noble cause of public health can be twisted into a pretext for pervasive control. Let's start with a truth we can all agree on. Public health is a good thing. Clean water, vaccination campaigns, controlling outbreaks. These are triumphs of human cooperation. I'm an engineer by training. I believe in systems that solve real problems. But as an entrepreneur and a storyteller, I've also learned that every system has a shadow. And the shadow of our modern public health infrastructure is a surveillance capability so intimate, so total, it would have been unimaginable just a generation ago. Think about what health data actually reveals. It's not just your temperature or your vaccination status. It's a map of your movements, your biological vulnerabilities, your genetic predispositions, your mental state, your social contacts. It's a diary written in your own blood and neurons. During the pandemic, we saw a global, real-time experiment in collecting this data. QR codes for contact tracing, apps that track proximity, mandates tied to digital certificates. The emergency justified the speed. But here's the critical question. When the emergency fades, do the systems fade with it? History whispers a consistent answer. No, they don't. They simply find a new purpose. That brings me to my first point, the normalization of the biosurveillance footprint. The infrastructure built for a pandemic doesn't get dismantled, it gets repurposed. What was once a contact tracing app becomes a universal health ID. The temperature scanners at the airport become permanent biometric checkpoints. The centralized database for vaccine records becomes a repository for your entire medical history, accessible not just to your doctor, but potentially to your employer, your insurer, your government. The precedent is set. We, the public, become acclimated to the ritual of scanning, showing, and sharing our biological credentials as a condition of participation in society. We're taught that to question this is to be against health itself, against safety, against the collective good. That's a powerful silencing mechanism. And this leads directly to my second point, the shift from population-level management to individual-level prediction and control. This is where the engineer in me gets chills. With enough biometric data, from wearable fitness trackers, from smartphone health apps, from sewage surveillance, from social media sentiment analysis, algorithms can now model not just the spread of a virus, but the behavior of individuals. They can predict where you'll go, who you'll meet, and even your likelihood of getting sick or spreading illness. Once you can predict, you can prescribe, and a prescription can easily morph into a mandate. We could see a world where your access to public spaces, transportation, or even your job is dynamically governed by a constantly updating health score, a social credit system dressed in a lab coat. Your personal choices, what you eat, how late you stay out, who you associate with, could be nudged or penalized based on their calculated risk to the biosecurity of the state. The goalposts of public health can be moved to encompass almost any behavior deemed undesirable. Now, I'm from Bangladesh. I've seen firsthand how quickly a crisis can be used to consolidate power and restrict freedoms. I've also built a life here in New York, in a country founded on a deep suspicion of state overreach. This tension lives in me. I believe in science, and I believe in liberty. And that's why my third point is about the erosion of informed consent and bodily autonomy. True public health is built on trust and voluntary participation. But a system of control is built on compliance. When health surveillance becomes invisible, woven into the fabric of everyday technology, your phone, your car, your smartwatch, consent becomes a fiction. You can't opt out of the architecture of your society. When your ability to work, travel, or bank is contingent on your participation in a biometric monitoring scheme. That's not a choice. It's coercion. We surrender the most personal territory we own, our own bodies, not with a signature, but with a sigh of resignation, because the alternative is to become a digital hermit. So where does this leave us? I'm not a doomsayer. I'm a problem solver. The unraveling here reveals not an inevitable fate, but a critical design flaw in how we're building our future. We've focused entirely on the technical efficiency of these systems and neglected their ethical architecture. We've forgotten that data isn't just bits and bytes. It's human experience, it's dignity, it's freedom. The way forward requires a new kind of vigilance. It means demanding that any public health surveillance be strictly temporary, proportional, and transparent, with sunset clauses that automatically dismantle systems when a crisis ends. It means fighting for data minimization, collecting only what is absolutely necessary, and never allowing it to be merged into a single, lifelong, trackable profile. It means decentralizing data storage, so no single entity holds the keys to our biological kingdom. And most importantly, it means rehabilitating a robust cultural conversation about privacy, not as a selfish desire, but as the very foundation of a free and healthy society. A society that is constantly monitored is not healthy, it's anxious. It's not safe, it's subdued. The thread we've pulled on today is tangled with the best and worst of our instincts, to care for each other and to control each other. The app on my phone that knew my journey wasn't evil, but its quiet, presumptuous knowledge was a tiny signal in a vast, humming network of observation. Our task is to ensure that the network serves people, not the other way around. That our health is protected, but our humanity is not overwritten. Thank you for listening. If this conversation resonated with you, please share this episode with someone who thinks deeply about the world we're building. For more from the Unraveling Thread, subscribe wherever you get your podcasts. This is Ibnul Jaif Farabi for Light Not Studios. Until next time, stay curious and stay engaged.